All right, we are live. Hi, I am Caitlin. I'm the Community Outreach Director over here at TherapyWorks, and I'm joined today on Facebook Live by James Quinn, one of our physical therapists, and he's our clinic director. So he's here today to talk about pediatric physical therapy, which is honestly one of the more fun side of what we do over here at TherapyWorks.
Definitely, right? Playing with the
Sure.
kids.
It's always so much fun. So let's just kind of start, how old do kids have to be before they can receive physical therapy?
Oh my goodness, we work all ages, but even just the little teeniest babies, from a couple months old, all the way up through, junior high, high school. I mean, there's no bottom age, I guess, and no top.
Yeah, I mean, we just had a post last week about a patient who's about to turn 100. So, 2 months, 100 doesn't matter. We'll treat you all.
Absolutely.
So it's kind of hard, the older kids, of course, you can kind of hear about like my side hurts or, my knee hurts. But like, what about, especially smaller kids? What kind of conditions can physical therapy help them with?
By far and away, the most common thing we get referrals for is just torticollis, which is essentially literally means twisted neck, but it essentially is just a tightening of cervical muscles. It actually pulls the neck off to one side. It can happen in the birthing process, or even, but also it could be related to just how they're sleeping or playing. That's maybe pushing them off to one side more than the other. And as those muscles shorten and tighten, they just need to get into a PT and see if we can stretch it out and straighten things back up.
Yeah, for sure. What are some other things that we're able to help with?
All over the board, your general, like cerebral palsy, some extreme of cerebral palsy, or just maybe some delayed milestones, any really developmental delays, anything musculoskeletal, movement oriented. Toe walking is another big one I see in kind of middle schoolers. It can be all over the place though.
Yeah.
Some big ones though.
I mean, musculoskeletal, that covers a lot of things. So
right.
It can really look different from person to person.
Yes.
So I know that even adults are kind of scared that physical therapy is going to be painful. And if you're a parent, you especially don't want your kid to be in pain. So is physical therapy painful for kids?
I wouldn't say painful. I think these little ones, especially, infants, it can be uncomfortable, but I think it's more that they don't love these positions. They've fallen into these patterns because they didn't like the other pattern, so to try to pull them out is definitely, they fight against it. So there might be some tears, but overall, I'd be hard pressed to say it's painful for them most of the time. Is it uncomfortable? Do they not love it? Maybe not. But once you get over that early stage and you get over some of the initial stretching and the kind of fighting against those tendencies, I think that painful part goes away, the uncomfortable part goes away quickly. And that's just fun.
For sure. And of course, if they're coming in, like, those conditions often lead to pain down the road, even if they're not having it yet. So, it's kind of pick your.
No, you're absolutely right. Is a little bit of temporary discomfort and pain worth avoiding some long-term issues? Absolutely, it is. No question, right?
For sure. Like permanent trouble walking versus a couple tears today. Like it's not really a question.
No, absolutely. Or the torticollis, yes, it's uncomfortable for those little ones to stretch on it, but it can lead to all sorts of issues with head shape and just consistent neck pain, things like that. So you got to jump in and take care of it either way.
Yeah. And so that kind of leads into the next question a little bit. So I mean, even if it's more discomfort than pain, is it scary? Like, are kids usually scared of physical therapy?
Oh, I think there's always a little bit of nerves. I think the little ones, it's not really the little ones that are nervous. It's more the parents. And then in kids, I see, it's funny because I had a 10-year-old just earlier today, just an hour ago, really. And I do remember his first day and he was a little nervous. Mom was a little nervous, but now they look forward to it. He loves coming in. I mean, essentially, you try to make physical therapy for younger kids. I'd say, anybody, any preteen age, it's more like games, so really, hopefully they should be having fun coming in. It should be a positive experience overall.
For sure. I mean, and you guys do use a lot of balls, so like it really isn't super distinguishable from toys.
No, you're absolutely right. A lot of these tools we're using early on it is toys essentially.
Yeah.
Right. Got to get them motivated, and that's their motivation. So it works.
So, if there's a parent that's considering physical therapy for their kid, they might be a little bit nervous and uncertain what does it look like? So, what can you expect going into physical therapy for, say, like a young child, like preteen?
Our youngest, obviously, parents would often come back, if we're dealing with toddlers or kids, they're never coming in on their own, the parents are a part of it. And that's such an important part too, because it's not what I can do for that child in the 30 minutes that they're here, or 45 minutes, whatever it is. It's then what those parents can learn and take home with them and continue to practice all week long. That's what really makes the difference. So, and then as they get older, again, kind of like we mentioned before, it's not quite your standard, I'm going to have you do 20 leg lifts and 50 sit-ups. It's maybe a little more game oriented, because it is those developmental milestones oftentimes that we're trying to reach. If it's practicing kicking a ball or balancing on one foot to throw a ball or something like that, we try to orient it more that way. So usually a little easier, a little lighter than your standard therapy, I suppose.
Yeah, I mean, I'm not a therapist, but I do hear you guys a lot of times, kind of like challenging kids, or there's a lot of cheering involved. Younger ones.
Yeah, you should. I almost felt bad earlier today with my 10-year-old. I think we're almost making too much noise back there. We had the whole place was rocking.
Yeah, well, I just having the kids around the clinic is so much fun. They just bring so much energy to it, and it's really great to watch how quickly they tend to bounce back, Yeah. And even kids, I mean, I'm not a therapist, but I've been around and kind of seen you guys treating them over the years. And it definitely seems like even, kids that have long-term issues can make a lot of progress a lot quicker than you would expect.
It always surprises me, even as a therapist, even though I've seen it time and time again, I am always surprised at what these kids can do, and oftentimes short period of time. So you're absolutely right.
Sure. So how, and this one's kind of a tricky one, but like, how can you tell if your child needs physical therapy?
I think it can be tricky. Oftentimes with the little ones there, you got your regular checkups with your pediatrician, and they're always looking for these signs and symptoms as well. But I think if always, we kind of keep an eye out for milestones along the way too. When should, if a child's rolling between, say 4 and 5 months, and if they're way behind, there's always a variant, so you don't need to be knocking on the door as soon as somebody, if it's five months in a day and your child's not rolling, there's always such a big difference, right? But I do think that if things go too long and you're like this, that maybe he's not achieving, or he or she's not achieving what you might want them to see, or it crawling from 6 to 9 months, again, if they're going way up to a year and they're still not meeting some of those milestones, then it might be worth seeking a consultation and making sure that everything looks good. I think.
What about older kids or maybe like teenagers?
Yeah, no, that gets a lot easier, right? I mean, I think kids get a lot of bumps and bruises, but these active kids, at the end of the day, they're going to let you know, and they can let you know if anything's persisting longer than a couple of days. Really, that's because kids rebound so quickly, like we just said. So if you're in an injury, then it's not gone within a couple of days of normal activity. You probably want to get them in and get them checked out for sure. Yeah.
So if you think that your kid might benefit from some physical therapy, what's your next step? What do you do?
We also here we have the complimentary consultation, which is obviously an easy thing to check in on, and that just would have somebody come into our clinic, call in ahead of time, get an appointment set up, and we usually do like a 15 to 20 minute just consultation, which involves, myself or one of my colleagues looking at the condition and just seeing if it really fits the mold for something that would be appropriate for physical therapy. If we're ever worried about anything significant, we can always refer back to their general practitioner, just for further imaging or further input. But if it just seems pretty standard musculoskeletal, we can always get them in for a full treatment, so to speak. So
yeah, that's usually an especially great option for a lot of the stuff that kids kind of have going on, like the sprains and strains and those sorts of things that are like pretty easy for a physical therapist to pretty quickly see, like, okay, yeah, this is something that's standard, something we can help, we can take care of you, kind of thing.
Yes.
And it's also really great for, like nervous parents, because we talk about the complimentary consultations all the time for adults, but if you're a nervous parent and you're concerned about that your kid is still walking on their tiptoes, or that your kid is complaining of knee pain and has been for 2 weeks, and you're up late on WebMD and can't get in to see your pediatrician for 2 weeks and 3 weeks, and this can be a really easy place to start. And like James said, TherapyWorks has been around for, what is it, 28 years now, something like that. So like our relationships with the doctors in the community are really great, so we can always reach out to them, connect back in. We have a very team mindset going forward, so we're never going to like give you physical therapy you don't need, or not refer you back when it's something that's not our expertise.
There you go. I think you're absolutely right. I think at the end of the day, it's always a team approach. That medical team looking from all sides, and I think we can be one gateway into the system, and by all means, I think oftentimes that's all it takes. But if not, it never stops here. We can make those referrals one way or the other, or find the appropriate way to go.
Right. I mean, we know where the resources are. Like that's really what it comes down to, is we know where to send you.
Sometimes it's just getting your foot in the door, and I think you hit the nail on the head too. Sometimes it's just a matter of talking to somebody and giving yourself a little bit of peace of mind, even if it's just we end up coming in for a handful of sessions to get something basic stretched out and worked out. Sometimes that's all it takes, but a lot of peace of mind in the conversation alone. So.
Of course. All right. So is there anything else you'd like to add before we sign off?
No, I think, when it comes to these kids, I think we want them to come up healthy. We want them to come, for everything to work out well. I think, I love working with kids and young athletes so much. They heal so fast. So it's a lot of fun. I'd say, don't put things off too long. Like I said, if you got something that's lasting, longer than a week or two, get them in. Don't wait till 3/4 of the way through the season, when they can't even walk and they're hobbling after games. Kids are resilient, so they're always trying to push through these things. And sometimes it's okay to take a week off and to get a little bit of treatment and to get back to 100% before you actually, cause something to be damaged in any significant way, so.
For sure.
Take care of these young ones, right? Yeah. That's about it.
It's so funny. I'm noticing as we're talking that we are both smiling so much more than we usually do in a Facebook Live.
Right.
We're just
like, talking about kids.
They're really just like the highlight of, when they come in, it's just like sunshine.
Yeah, no, it is. I was laughing earlier today with my 10-year-old. We were working in the back gym, and there was one or two guys out on the bikes that kind of look into the gym. I think they're both probably in their 70s or 80s. And they were I think they were having a better time just watching us work out in the back gym than they had it sitting on the bike in a long time. So it was fun. I think everybody's having a good time, right? So.
For sure. All right. So, just to sum up, if you're concerned about your kid, or you think that they might benefit from physical therapy, talk to their pediatrician or come in for a complimentary consultation. Either way, we'll get you moving in the right direction, and just give us a call. All right.
Awesome. Thanks, Kayla.
Thanks for talking with me today, James.